Hello, friends. Today we will discuss prostate enlargement, its causes, symptoms, and treatment. Benign prostate hypertrophy without any symptom need not to worry about. No action is necessary for that. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. Benign prostate hyperplasia overview. Benign prostate hyperplasia, that is BPH, is a common disease observed in 90% of men over 60 years of age. Benign prostatic hyperplasia is the most common benign tumor in men. The exact cause of this disease is still unknown, and environmental and genetic causes are thought to be involved in its development. As studies show, 50% of men between the ages of 51 to 60 and 90% of men over 80 years have been histologically diagnosed with BPH. Benign prostatic hyperplasia is when the prostate and surrounding tissue expands. The prostate goes through two main growth periods as a man ages. The first is early in puberty, when the prostate doubles in size. The second begins around age 25 and continues during most of a man's life. As you age, your prostate may get larger. BPH is when it gets large enough to cause problems. The size of a walnut or golf ball in adult men. This is the size of a normal prostate. It can grow to be as large as an orange, weighs about an ounce or so normally. As the gland enlarges, it can squeeze the urethra. The bladder wall becomes thicker due to overreaction. Over time, the bladder may weaken and lose the ability to empty fully. Urine then remains in the bladder. These problems cause many of the lower urinary tract symptoms of benign prostate hyperplasia. If you are not able to pass urine at all, called retention of urine, or if you have renal failure, immediate attention is required. This is the normal and the hypertrophied prostate. This is hypertrophied prostate. Incidence. Men in their 40s have 8% prostate enlargement. Men in their 60s have 60% of the men have prostate enlargement. And men in their 90s have 80% of the men have enlargement of the prostate. Why does benign hypertrophy or prostate happens? Normal prostate, the action on it is of dihydrotestosterone, which is a product of testosterone, and that gives rise to benign prostate hypertrophy. Estrogen, high estrogen is the another, and time lag due to aging. These are the reasons supposed to be causing enlarged prostate. Signs and symptoms. Slow urine stream. Feels like need to strain, but less of urine is passed. Bladder can't empty fully. There is some retention after you urinate. Frequent urination. You have the urge to urinate frequently. Need to go soon after. Once you have urinated, immediately thereafter, you need to go for urination again. There may be bladder stones due to retention of urine. There may be bleeding due to inflammation or infections, or complete inability to urinate, and there may be retention. There may be dribbling. You may not pass urine in a continuous stream. There may be dribbling after you pass urine. There may be trouble holding it. You can't wait to pass urine. There may be low back ache continuously, or nocturia. There is night urgency of nighttime urine urgency. There may be hesitancy. You may like to pass urine, but urine may not come out from your urethra. Intermittency. There may be intermittent passing of urine. Diagnosis. First, patient tells his symptoms from which he is suffering from. Then measure the urine flow. See how much urine is left in the bladder after voiding, and check the urine analysis for any inflammation or blood in the urine. DRI, digital rectal examination. This gland is very, very fibroelastic to feel with the finger. And when it is rock hard, we may suspect some CA in the prostate gland. Digital rectal examination helps us to determine the size of the gland with the feeling, or may not be accurate, but gives a fair estimation. Helps to make sure cancer is not a concern, because a cancerous prostate gives a very rock hard or some irregular type of prostate. Which treatment is right? Treatment depends on the symptoms of the patient, depends on goals and preferences of the patient, depends on prostate size and anatomy of it, depends on other health considerations, comorbidities. Typically, medications or small procedures are offered prior to the formal prostate surgery. Medications. First, alpha blockers are given. Medications work on the alpha receptors in the smooth muscles of the gland and neck of the urinary bladder. This allows the urethra to open more easily to relax. Blockage of receptor relaxes urethra, allows the urethra to open more easily. What are these drugs? Flomax, Cardura, doxazocin, and alphazocin. Other group is 5-ARIZ, 5-alpha reductase inhibitors. These drugs shrink the prostate, block conversion of testosterone to dihydrotestosterone, and dihydrotestosterone is what causes benign prostate hypertrophy. Over time, without dihydrotestosterone, prostate starves and shrinks. But 25% reduction in prostate size with these drugs. Best for larger sized prostates. Finasteride and dutasteride are two medications in this group. Small procedure, urolift, in which a thread is tied around the prostate to open its urethral opening, just like as shown in the diagram. Rhesum, here the steam is injected into the prostate, which ultimately squeezes the prostate and give way to the urethral opening to give it fully opening. Catheter for 5 to 7 days is left in the prostate because the prostate swells when we inject steam. There may be some inflammation also. And this benefit lasts for at least 4 years. Surgery, TURP, transurethral resection of prostate. It's the gold standard prostate surgery, the oldest and bread and butter BPH surgery, performed under general anesthesia, maybe GA or spinal, done entirely with a camera that is placed through the penis. Overgrown prostate tissue is whittled or carved out slowly and slowly. Spend one night in the hospital and then he can leave the hospital. Catheter is in for 1 to 5 days. Surgery, green light laser, special laser type that photoevaporates the prostate. Laser causes very little bleeding as it vaporizes, takes longer to remove the prostate tissue versus TURP. Removes less tissue than TURP. Higher chances of needing a second surgery later in life in this type of surgery. Most patients go home same day after the procedure. Catheter for 1 to 3 days is left inside. Can be performed while patient is on blood thinners. Suprapubic prostatectomy. Old procedure now typically performed with surgical robo. For very large prostate, more than 100 gram, this is used. Not performed through the urethra. Bladder is opened, prostate cut out from above, and bladder is closed. Natural treatments. Pumpkin seed oil, cucurbita pipo, may help improve benign prostate hyperplasia. Pumpkin seed oil eased symptoms of enlarged prostate and improved participants' quality of life over a 3-month period. Observed a reduction of prostate size with pumpkin seed oil. Significantly reduced overactive bladder symptoms such as urinary frequency, urgency, and urgency incontinence. Natural treatment with Sa palmetto, Sironoa repens, reduces the size of the prostate or eases the urinary symptoms that come with an enlarged prostate. You may need to get up less often at night to pee. It can improve your flow when you go. It can ease painful urination. It may take 4 to 6 weeks for Sa palmetto to have an effect. There are no food sources of Sa palmetto, may help low sperm count. Natural treatment with the stinging nettle, Urtica dioica, causes anti-inflammatory, anti-tumor, antiviral effects, modulating of the immune system, relieves the symptoms of BPH due to the compounds it contains, such as phytosterols, lignans, and polysaccharides. Studies suggest that stinging nettle is comparable to finasteride in slowing the growth of certain prostate cells. The root and above ground parts are used as medicine. 287 BPH patients who had been treated with nettle, Urtica dioica, showed significant reduction in international prostate scores, serum PSA, and prostate size. Lycopene, promising nutritional component for chemoprevention of prostate cancer, effectively inhibits the growth of normal human prostate epithelial cells. If lycopene inhibits the growth of prostate cells in vivo, this may likely affect the growth of prostate tissues in humans. There is also a link between lycopene and prostate health, along with other possible benefits. African prune tree, Pygium africanum. Nocturia was reduced by 19%, residual urine volume by 24%, and peak urine flow was increased by 23%. Adverse effects due to Pygium africanum were mild and comparable to placebo. ryegrass pollen, sickle cereal, may affect the male hormone testosterone, relax the muscles of the tube through which urine flows, urethra, and improve how well the bladder can force urine out, reduce prostate inflammation. Cernilton is a common branded ryegrass pollen pharmaceutical. This medication may be effective. Help improve benign prostate hypertrophy symptoms such as frequent urination and nocturia. Zinc. Estrogen inhibits the uptake of zinc in the intestines. As a person's estrogen levels increase with age, their intake of zinc decreases. Zinc can also decrease the production of DHT and inhibits this androgen from binding to receptors, potentially reducing BPH symptoms. Poultry, seafood, and several seeds and nuts, such as sesame and pumpkin seeds, contain zinc. Soy. Soy is an inhibitor of 5-alpha reductase and a low-potency estrogen. Soy may block the receptor sites that the stronger estrogens use to increase the accumulation of DHT. Beta-cytosterol is a major compound that occurs naturally in soy. People with BPH who took a 20 milligram dose of beta-cytosterol 3 times a day experienced an increase in urinary flow and a decrease in residual urine volume in the bladder. Omega-3. A diet rich in omega-3 fatty acids can help reduce the action of compounds that play a role in prostate inflammation. Foods rich in omega-3 fatty acids, cold water fish such as salmon, mackerel, and sardines, as well as eggs, walnuts, and some vegetable oils contain omega-3. Lifestyle tips for managing BPH. Attempting to urinate at least once before leaving the home to avoid urinary leakage or other potentially stressful incidents in public. Double voiding means when you urinated, after few minutes, you may again void so that the residual urine may be thrown out. Trying not to drink fluids in the 2 hours before bedtime. Maintaining a moderate body weight. Exercising regularly for the whole body as well as for the prostate. Avoiding or limiting products that cause dehydration, such as cold medications and decongestants. Using absorbent urinary pads or pants to absorb urine leaks and decrease wetness and discomfort. Using urinary sheaths like condom shaped and fit over the penis to drain urine. A small bag is strapped into the leg or abdomen. Following urination with a urethral massage, which involves gently pressing the fingers upwards from the base of the scrotum to try to squeeze it out. Eating plenty of natural plants, particularly those rich in beta-cytosterol, such as green leafy vegetables, rice bran, wheat germ, peanuts, corn oils, nuts, and soya beans. Avoiding dietary supplements or environmental exposures that may increase circulating hormones level, such as pesticides, herbicides, and recombinant bovine growth hormone, rich dairy products. Avoiding drugs that include dehydroepiandrosterone, androstenedione, testosterone, and human growth hormone. Thank you very much.